Good morning, everyone. This is the conference committee for H.816, an act relating to regulating the use of artificial intelligence in the provision of mental health services. Just want to welcome everyone. And I think we will, because of time, there's so much going on at this late stage. I think we will just jump right into letting our alleged counsel go through the differences between the two versions of the bill.
Sure. Good morning, Katie McGlynn, Office of Legislative Counsel. I sent everyone a side-by-side summary last night. Let me pull that up. Okay. So it's not organized by act or bill number or section number because the section numbers don't all match up. Instead, it's organized by topic. Both bills have a purpose section. The House version is a bit longer. It's safeguarding individuals seeking mental health services in Vermont by ensuring therapeutic judgment, clinical decision-making, therapeutic communication remain the responsibility of a mental health professional instead of delegated to an AI system, respecting individual choice in selecting mental health services, allowing responsible use of AI for administrative, operational, documentation, quality improvement functions that support access, efficiency, and innovation in mental health services. Conversely, in the as-passed Senate version, we're also safeguarding individuals seeking mental health services from psychological harm by ensuring that mental health services are delivered by mental health professionals and not independently by AI systems. So you're picking up the concept in that first bullet in the Senate version. The next section is the unprofessional conduct for certain OPR regulated licensees and applicants. This is very much the same. In concept, you use slightly different words. In the Senate, the phrase engaging in the prohibited use of AI was used to replace misuse because it was tracking the title in the preceding section, prohibited uses of artificial intelligence. And it was cross-referencing that section. So it was just tracking the language used there. So that's the difference there. The next section is the prohibited uses section. So you have definitions. Some of the definitions are fairly similar. The definitions of AI are similar with the exception that the House version includes generative AI in the definition of AI, whereas the Senate version doesn't have a definition of generative AI. Both sections have a definition of therapeutic communication, but they are not identical. And we can dive into that in more detail if you want to look at it, but I know we are short on time. In the House version, subsection B prohibits a person, corporation, or other entity from offering, providing, or advertising mental health services in the state that represent AI as providing therapeutic judgment, diagnosis, treatment, or therapeutic communication. In the Senate version, you're prohibiting a corporation or other entity, not an individual, from providing, advertising, or otherwise offering mental health services, including through the use of AI to the public, unless mental health services are provided by a mental health professional, approved and reviewed. In the House version, we have language that the section doesn't prohibit the use or disclosure of AI for administrative purposes, documentation, operational purposes, as long as professional clinical responsibility is used. We have similar language with regard to the violations that this is enforced under the Consumer Protection Act by the AG's office. The Senate version has a civil penalty of $10,000. There's not a penalty in the House version. Both bills have language that this does not preclude or supplant other remedies. And then the Senate version has a subsection D that is not in the House version, but I think it captures much of what is trying to be done in the next section for the House. So this section does not preclude mental health professional operating within their scope of practice from utilizing AI tools that are HIPAA compliant, so long as the mental health professional reviews and approves any mental health services. So I think that sort of summarizes a lot of what this next section does. This next section was only in the House version. It has a lot of definitions that didn't make it into the Senate version, including definitions of administrative support, clinical responsibility, consent, peer support, religious counseling, supplementary support, etc. In this section, it authorizes a mental health professional to use AI for administrative support, supplementary support, and operational and quality improvement functions like scheduling, billing, maintenance of clinical records, so long as the mental health professional retains that sole clinical responsibility. In subsection C, use of AI for administrative support and supplementary tasks, including transcription and recording, subject to privacy protections already in statute. And patient consent is required when AI is used to record identifiable therapeutic communications. In subsection D, it prohibits a mental health professional from using AI in a manner that allows AI to independently make therapeutic decisions or generate treatment plans. The section does not prohibit a mental health professional from disclosing or describing a mental health professional's use of AI for administrative support. And then in subdivision 3, the section does not apply to religious counseling, non-certified peer support providers, generalized education, self-help resources that do not purport to offer mental health services. Okay, now there's language that is only in the Senate version, and that includes having parallel language to the OPR professional responsibility language that was up above, but this pertains to the Board of Medical Practice regulated licensee and applicants, because there are a few individuals under your definition of mental health professional who are regulated by the Board of Medical Practice, not just OPR. So now we have parallel language for all professions. And there is a report in the Senate version that is not in the House version that requires OPR and the Board of Medical Practice to submit a report to the General Assembly containing recommendations on the regulation of the use of AI by regulated professions this coming January. And then an area of concurrence that you both would like the bill to take effect on passage. So that is it, but I can spend a little more time if there's anything you want to drill down on.
Thank you very much. Thank you. That was great. Any questions on the side-by-side that we went through just now? So, great. Well, we obviously felt good about the version that we sent back to you, so we're curious about what what were the issues that brought us here today. We'd love to hear if you could share with that. That would be great.
First of all, thank you for your work. I think you tightened up a lot of what we did, just notably in section 7715. So thank you for that. I think you made things more concise and clear in many places. We heard from providers immediately that they had concerns that this would limit them from using evidence-based digital therapeutics. And that is something that we really don't do. So things like apps to help them with insomnia. There are also emerging tools that are cutting edge, and they're definitely the way of the future that clinicians need in order to really step into modern therapy. And these are things that help people with schizophrenia, for example. So we want to support the evolution of this field, and we want to support providers who overwhelmingly contacted us. The psychological associations in Vermont and New Hampshire who have testified in our committee, however, they felt the changes that were made really empowered them to do those things with the digital therapeutics. We also heard from researchers who, with the language that had that the bill had evolved to, would have prohibited them from doing any research to develop those tools. I spoke with a researcher at Dartmouth who works with a lot of Vermont patients to develop tools, and so our patients are actively informing these things, and he would lose his research grants if we went forward with that. So we don't want to prohibit that either. I also heard from technology companies who provide these services and tools. They were concerned that the $10,000 private right action would, one, it was duplicative to what's already existing in the consumer protection laws that Vermont has. And two, it would allow repeated, potentially repeated claims against them for each use. And so I didn't think that was fair. And we thought we'd recommend removing that line of 2,000, and the providers agreed with us on that. I think one last thing that, just for clarification, I didn't quite understand the need to have HIPAA in there, because HIPAA is more around data privacy and protection, sort of on the back end of using these tools. It's not on the front end where we're really looking at it with the interface of, where these tools are deployed and how they interact with patients versus the data storage and protection after the use. So I would suggest that we focus on, making sure that people are using tools that are evidence-based. Finally, the Office of Professional Regulation, we recommend that they be added to, Brian, what's the name of the council?
Yeah, the Artificial Intelligence Advisory Council.
Yeah, which we already have in Vermont, and they agreed they wanted to be added to that. And so we recommend that rather than them working with the Board of Medical Practice to come up with a report, that they be added to that council where they can really bring a voice for mental health and other providers that they regulate to that council, and then give us a little more comprehensive report on what they think prohibited practice and should be, and dig into the issue
Instead of the board.
Yes.
OPR instead of that. Okay, so just to recap, make sure I'm understanding. It sounds as though you would like us to remove the $10,000 civil penalty. You'd like us to replace the board medical practice with OPR on the AI working group or task force, whatever. And what was is there something else? If you look at the document, draft number 1.2, so the media conference that Katie drafted. Katie did a great job of highlighting those things that I noted.
Is it the House or the Senate? I have to
Report of the committee of conference.
Did you get one? There was one.
Maybe I do.
Yeah, I just
There it
noticed
is.
too that on page 3, the changes begin and they're highlighted in yellow.
Thank you.
Thank you.
Yeah, they're highlighted in yellow, so you can see all of the changes that we are recommending.
So there's a change to definition, right? On page 3, it doesn't have the line numbers, but it's highlighted. There's change in the mental health services definition that we're suggesting, right? Can you explain that? Well, I don't see I can look for the original. Because I know there was an issue with, we had heard something about the definition having.
This aligns with maintenance definition for mental health services. So we want to be consistent regionally with what people are doing. And so it has been requested by providers that we align to.
Okay. So there are some small word changes throughout the bill, and then the 3 main pieces are the aligning the mental health services definition with Maine, $10,000 civil penalty, and replacing OPR with board medical practice. Maybe I would love to hear from you at this point.
There's also the in subsection B on page 4. There's language that allows the use of tools approved by an institutional review board or privacy board for the purpose of a study.
That's great. Yeah. Okay, super.
So I think what I would highlight is in the language changes, you'll notice we added clinical in a bunch and mental health in a bunch, and then refined the definition of mental health services. That's that I just wanted to say, like, a lot of the yellow is reflecting. So I think you did boil it down to I believe it's 4 key things, right? There's the definition changes, OPR instead of Board of Medical Practice. The fine being removed, and what was the fourth one? You just, because just, thank you, the research exemption or whatever you want to call it, yeah.
Wonderful. Any questions from the Senate side at this point? But anything else you would like to offer?
I would just say I appreciate that you worked on this and the other AI bill and that you brought it forward and that I think we're only suggesting these changes because we heard this is how it works. We heard feedback afterwards and we were responding to that. And we went to the conference committee because it was quicker, and I appreciate your understanding.
We appreciate you also trying to protect Vermonters and protect vulnerable folks who, you know, are in need of mental health counseling. This is just a great way to start. It's a good start.
I know we've got a lot of work ahead of us, but
Yes,
a good start.
So, yeah, so I'm looking at the definition that you have on page 3, and it includes behavioral health.
Which we defined in law recently, remember that?
Yeah.
We did
Yeah.
define it.
Yeah,
recently.
finally.
And how many practitioners have we got who would be subject to this? Probably a few, but
Oh, quite a few.
yeah. Okay. Then my other question is with regard to the Board of Medical Practice and why you would exclude them when they have oversight over specific areas of mental health counseling.
Are they on the AI council?
No, we are in 814, which the governor did sign, so it's in effect on passage, so soon we will see the Vermont Medical Society appointing someone. So there will be an MD or someone connected to the MDs
Yeah.
on there, but there is not Board of Medical Practice representation they won't be added. They could be included through the language, through the language in 814 that says, I forgot how the other
Interact with
stakeholders.
folks. Yeah, exactly. Yeah.
Okay, but OPR is on the advisory board, I'm trying to remember.
They're not, but we would be, we would be adding them with this.
Yeah,
So it makes sense to me. And we added the treasurer because they're looking at public finance. And since we're asking them to look at regulated professions,
well, okay, that'll be an interesting discussion.
Yeah, that will be.
many interesting discussions.
So might I suggest that we only have about 7 minutes before the next conference committee. I think we need to start, the 3 of us and Katie as well. Could you possibly wait outside while we have a quick conversation to see what our next steps could be? Is that all right?
You want to wait, like,
If you don't mind, just like a few minutes.
yeah, I won't go anywhere.
Don't
I get
go
distracted
anywhere,
easily.
Brian. Thank you.
Stand by the portrait.
Appreciate it. And we can go up.